Low back pain got you down? Well, I'm here to tell you that the quick fixes that you're trying probably aren't going to be helpful. I'm Dr. Robert Moss with Moss Rehabilitation Center. I've been helping patients with back pain with over 27 years and even suffered some back pain myself. So in this video, I'm going to cover a couple of things that you should really consider if you are having low back pain. Number one is quick fixes are just that. They're a quick fix, but it's not really a fix. So you're doing something to help minimize or kind of mask the pain that you're having, which none of us like to hurt. And so whether you're taking some ibuprofen, some Tylenol, maybe you using hot packs, ice packs, maybe even go to the chiropractor, all those things are designed to help reduce your pain and your symptoms, but they don't fix the underlying problem. And here's where most people fail, is what they do is they will mask the problem, which for me, I have developed the 3 Ds of trying to rehab any problem. And the first one is don't ignore your problem. So if you are doing something about the pain that you're having, congratulations, you're at least trying to address it. However, the quick fixes with the medications, the TENS units, even manipulations, things like that, that's all they're doing is they're just getting you out of pain, which again will start to let you function. However, you then need to progress into a few more phases of what I call the 5 phases of healing to help get you back on the road to recovery. So phase number 1 is all about doing some things to reduce the pain and inflammation. So that's where some manual therapy treatments come in. Maybe it's massage, it's acupuncture, we use deep tissue laser. All those things are great to reduce that pain and inflammation to allow you to start to move. But if you just stop there, you're going to continue to have pain in the low back. Maybe it's sciatica issues. Those are symptoms that will flare up and come back to haunt you again and again and again until you get to the point where you feel like surgery is typically your only option. So in the second phase, we focus a lot on mobility and core stability and strength. Frequently we'll see people that if they sit a lot, they have really tight hip flexors, they can't fully extend through the lumbar spine. And so not only addressing kind of the strength and the stability of the lumbar spine, but we also look frequently at the strength and the mobility of the hips and also the thoracic spine, so the area just above the lower back. Now, in the third phase, if you're feeling better, so you've gone through kind of phases 1 and 2, daily life, getting in and out of the car, rolling over in bed, all those things should start to feel a little bit better for you as your therapist progresses your strengthening and your stabilization program. But don't stop there, because then we're hitting phase 4. Phase 4 for us is all about getting you on a maintenance and injury prevention program. That means once you finish with your physical therapy with us, we encourage you to continue to exercise a couple times a week. It's just a good, healthy habit. But if you'll do some spine hygiene, like we recommend, the chances of your low back pain coming back are very low. And if it does come back, usually you start to know what to do and you'd call us and get back in quickly so we can help you address it before it spirals out of control. And then for us, our phase 5 is what we call performance enhancement. Now, most of you may think, well, I'm not an athlete, I don't really perform. But if you're still working, you're a parent, you're a grandparent, it doesn't really matter. Performance can be anything you have to do on a daily basis, and you want to make sure you don't have any pain or discomfort with it. As you age, your mobility is going to get less. Your balance is going to get a little poor, you're going to get stiff, you're going to get weak. And so performance enhancement is keeping you at a tip-top level where your mobility is good. You can go maybe walk in the park, you can play with the grandkids, you can get in and out of the chair without grunting and making those funny noises. You're not worried about sitting in a low couch, getting out of a low car, things like that. That may be enough performance. If you are a weekend warrior or an athlete, getting you back to your sport is the next level that we help with in performance enhancement. So I hope this has been helpful, letting you know that the quick fixes that you're after with your lower back are exactly that. They're just a quick fix. It's a temporary relief that you're getting. It will help with the pain, but don't fool yourself into thinking that that's going to make everything better and that your pain will never come back again. If you don't come in and address the root causes, which are typically some form of weakness combined with some stiffness in some neighboring joints, then you're going to continue to have lower back pain and issues for the rest of your life. So if you need some help, please contact our office at 817-220-6677. And I hope you found this video helpful. If you would like to hear more tips or some other specific exercises that I like to do with my patients, please leave a comment below. Be more than happy to shoot another video for you guys. Thanks and have a great day.